Dr. Daniel Warren, welcome to the Tick Bootcamp podcast.
Thank you. I appreciate you having me.
It is great to have you, and it's been a long time since we've desired to have somebody from Envita, and now, although it's taken 5 years, we finally have one of the good folks from Envita. So thank you for joining us.
Yeah, my pleasure.
So talk to us a little bit about first where you work, about Envita, and the type of work that you folks do at that clinic.
Yeah, so Envita is it's based out of Scottsdale, Arizona, and it's in Arizona by design. Our different practitioners have specific scopes of practice that allow us to do the therapies that we do. So that's why we're in Arizona versus any other part of the country. Most of the patients that we see, we're typically kind of the last stop for Lyme treatment, meaning that most patients go to a lot of other places first, unfortunately get misdiagnosed and aren't able to get help. And so by the time they get to us, as you can imagine, they have pretty widespread disease, a lot of complexities, a lot of concomitant diseases and issues. So pretty complex cases that we deal with. We mostly do IV care, although we do a variety of different treatments for various things that I'm sure we're going to talk about in terms of immune support and detoxification and anti-infectious treatments and all of those things that are important to the healing process. So we are an integrated clinic, meaning we use the kind of the best of both worlds, conventional and natural. And we also are a cancer clinic, so we treat late-stage cancer as well. I know a lot of people think that they're seemingly pretty different diseases, and on the surface they are, in terms of how they present and what they do to the body. But treatment-wise, there's a lot of similarities because, as you know, the immune system is so important to the healing process. Same is true for cancer as well. So a lot of what we do are immunotherapies to boost the immune system, to get the body working back to, functionality so it can heal. So
Let's talk about one of the things that you began to discuss, which is
yeah,
why Vita is located in Arizona. Um,
sure.
when when we first started focusing on Vita, which is actually several years ago, we've had several guests who have gone through your medical center and they've had a great deal of success. Um, but when we were doing the early research on you, we came to understand that the reason Envita is set up in Arizona is because you have more flexibility to use different treatment modalities than you would in some other states, meaning the medical boards are not as aggressive in limiting the standard of care or the type of treatment that you can offer. So can you give us more detail on that so our listeners understand why Arizona is an important place for you to be working?
Yeah, absolutely. So, as I said, doing integrative medicine where we do kind of a combination between the conventional therapies and the natural, and I can certainly talk more about why it's important to do both. But in order to do that, in order to have that large tool belt, and the reason why it's important to have a large tool belt, as I'm sure you're aware, especially with chronic Lyme, is because oftentimes you're not just treating Lyme, you're treating co-infections and you're treating secondary infections and you're treating mycotoxins and chemicals and heavy metals, and it's a variety of different factors that you're trying to treat. So you need a lot of different tools in order to individualize treatment plans because every person is different in terms of what those root causative factors are. So that's really, really important. And in order for us to do that, we have to have various physicians who have under their licensure the ability to do those tools. So we have MDs, DOs, and naturopaths who work at Envita, and each doctor type has a different scope of practice. Arizona being the largest scope of practice in the country for many of us, which allows us to do the things, meaning that if we were to be located in Connecticut or the Midwest or California, we wouldn't be able to do the same things that we're able to do in Arizona. So that's why, as I said, it's by design. It's very specific reason why we're in Arizona versus other places.
So let's now talk about the crossover between cancer and Lyme. And I
Hmm.
don't want this to be triggering, but I do think it does get to the heart, certainly from our perspective, about what Lyme disease is and why there are so many similarities. So you did tease, or at least you began to discuss in general terms that there really is a lot of crossover between cancer and Lyme disease, and it's really because in both cases these chronic illnesses are caused by immune dysfunction. So let's
Yes.
talk a little bit more about that, how chronic Lyme disease and just for the listeners or our community, they are going to want me to ask you about how you define Lyme disease because
Yeah,
we think we have a unique definition here. Um,
sure.
but before we get there, let's talk a little bit more about immune dysfunction and how it really isn't a non sequitur to have both cancer and chronic Lyme disease treated in the same place.
Yeah, yeah, definitely. So like I said, on the surface, it looks like it'd be strange to treat those two things because from a clinical perspective, they're very different. Obviously, cancer doesn't produce a lot of symptoms. Obviously, it's can be fatal in most cases. It affects the body in much different ways than Lyme disease does. Lyme obviously produces many symptoms, oftentimes, decreasing quality of life in a way that you don't see in cancer unless it's really late stage. Different levels of dysfunction in the body in terms of the systems of the body that get affected. So a lot of differences on the surface, but when it comes to
And when you
treating
mean on the
them,
surface, you mean symptomology, right?
yeah, yeah.
You don't
When
have
you
migrating
think of
symptoms the way in cancer the way you would in the Lyme world, but symptomatically or symptomology would be very different, but the root cause is the same.
Exactly. Yeah. And so, yeah, totally correct. So when it comes to figuring out the why of cancer, because obviously cancer doesn't just happen for no reason, a lot of the root causes that we see that affect Lyme patients are very, very similar in terms of the ones that affect cancer patients. So those things that I mentioned, those toxicities, those infections, a lot of them are carcinogenic, so they can cause cancer. It's why we actually do see a correlation, and we're kind of in this unique position because we treat both to see this, whereas most places don't. But we do see a correlation between Lyme disease causing cancer. It's not in every patient, certainly, but we see it with enough frequency that we look for Lyme disease in all of our cancer patients, and oftentimes we are the ones to diagnose them, even in cases where they aren't symptomatic. So you can have an underlying Lyme process going on where there hasn't been symptoms that have happened yet, but it still can cause a cancerous process. And so, for these patients who have had Lyme disease for many years and decades, it's certainly a risk. And so we do see that with testing, which is something that, of course, we're going to treat if we find it in our cancer patients as well.
So, Dr. Owen, do you think there's a causal connection between Lyme and cancer, or do you believe that the vulnerability that would cause you to suffer chronic symptoms of Lyme disease is similar to the vulnerability that could cause you to suffer cancer, and it's the immune vulnerability that is causing the two to at times appear at the same time, but one not necessarily causing the other?
Yeah, it's a really interesting question because I think you can make an argument for both, to be honest with you. I think that, you look at other types of infections where there's a clear correlation to cancer, HPV and cervical cancer, Hep C and liver cancer. There's clearly defined correlation. So we know that there are infections that directly can cause cancer. I think that from my experience, from my clinical experience, I do believe that that is true for Lyme disease as well. But you do bring up a really, good point in the sense that Lyme is an immune disruptor. So obviously, if you don't have a functioning immune system and you don't have that defense, you're susceptible to all of the things in our environment, and for the process of our body to go wrong. And so what I mean by that is that every single person has cancerous cells in their body, and the immune system is really good at going through and removing them because they're in a small quantity. But if your immune system is compromised, then it's possible that that immune dysfunction could lead to a cancerous process. So I think the short answer to your question, I think it's potentially both.
Quick question, I'm going to jump in, Rich, real quick. So, Dr. Warren, obviously there's two factors. You're immune compromised, and therefore you're more susceptible for your immune system to not respond and manage this cancer state. But we've had doctors on, like Dr. Ava Shapi, who talked to us about her studies where she found the presence of Borrelia burgdorferi, the bacteria that causes Lyme disease, in breast, ovarian, and endometrial cancer tissues, right? So she was saying that suggests a possible link between Lyme and the cancer. And she was positing that the Lyme brought on the cancer. So that's kind of a different relationship, as Rich noted. I mean, what are your thoughts on that? I don't know that we have enough research yet, but I'm curious what your views are just at an opinion level.
Yeah, absolutely. And part of the reason why I said my clinical experience, because as you mentioned, the research just isn't strong enough to have a definitive correlation there. But yeah, I do think that that's accurate. It's interesting that you mentioned that because there are tests and laboratory tests out there that you can actually test tumor tissue, cancerous tissue, and there's definitely evidence of infection in those tumors. And so I'm not surprised by that. I think it certainly correlates with what I've seen with patients who, I've definitely seen cases where patients have an obvious correlation to certain things that are carcinogenic, and you can make that correlation. But I've had cases where there is no obvious smoking gun, and we find Lyme disease, and so obviously you can make that correlation that that's a big factor in the cancer.
Yeah, and of course we've had many cases, for example, with different forms of brain cancer. Uh,
Hmm.
I think when Senator John McCain had passed away and they did the autopsy on his brain, he was suffering from a multiform glioblastoma, and they found the Lyme bacteria in his brain
Hmm.
tissue as well. So, the question always is the chicken chicken first, the egg first? Are they just there at the same time and not necessarily one causing the other? I mean, I think this is, a fascinating area to study. But I think what's most important from the standpoint of discussing this with our community is if you're sick from chronic Lyme disease, you're not necessarily going to be more vulnerable to cancer. But even more importantly, if you're suffering from chronic Lyme disease, the key to succeeding and overcoming this chronic illness is dealing with the immune dysfunction. Your immune system is going to win the day. It's not going to be whatever tools you're using to reduce the microbial load. It's going to be making sure that you are focusing on healing your immune system and your immune and resolving your immune dysfunction.
Yeah, yeah, absolutely right.
So now let's let's take the next step and build out your background. Tell us a little bit about you. Where did you go to school? Where's your specialty? And how did you end up at Envita?
Yeah, so I kind of had an interesting journey to get to Envita. I have wanted to be a physician since a young age. I told my parents actually when I was 8 that I wanted to cure cancer. And then I ended up deciding to apply to medical school and just kind of got disillusioned with allopathic, with kind of the conventional medical care system. So I went off and did other things, was an EMT for a while and taught and did various things, just trying to figure out what I wanted to do, and found naturopathic medicine. The school in Arizona, which is how I ended up in Arizona, is out in Tempe, and knew that was the fit for me. So I ended up going there. Took oncology classes in medical school and wasn't interested at all after that conversation I had with my parents. And then it was really my friend and colleague, Dr. John Ertley, who's our chief medical officer, who he had started working there a little bit before I did, and was recruiting me to come there. And I was in residency at the time, and told him, I can't. I'd love to, but I can't come yet. And so finally, when I finished residency, he said, "Okay, no more excuses. You're coming. You're interviewing," and just knew that it was the place for me. Like I said, didn't really at that time think I would have a career in Lyme or cancer, but it turned out to be a calling. I usually tell people that it found me versus me finding it. So,
So one of the challenges that folks in this community have is that because they feel gaslit by the medical system, they often want to step out of the medical system, and in some cases even refer to themselves as their own doctor. So can you talk to
mhm.
us about what caused you to be disillusioned with the traditional allopathic medical system? And can you use those experiences to give us some insight into why it's challenging to treat people in the traditional setting, and why perhaps patients are not having the experiences that they'd like to have because of the failures of the system?
Yeah, absolutely. So, I do want to say that I think allopathic medicine does, many things very, very well. But I do think personally that when it comes to chronic illness, there's a lot to be desired. I think the reason why I got disillusioned was because I was looking for a path that would allow me to help people heal. And I didn't see a lot of that in the allopathic world. It was more about band-aids. It's using medications to control symptoms, to control the disease, but not actually getting to the root cause of things. And so I think that's kind of what led me to go a different path, is because I wanted to get to the root, because I felt like that was the key to seeing true healing and lasting healing. And I think that's part of the reason why we get great results, is because that's what we're looking for. We're looking for all of the reasons why, all the variables that are at play, and oftentimes it's a lot. It's a lot of different things that are contributing to cause that dysfunction. But we do a lot of labs in order to investigate and find those things, so we can have a really good understanding of what we're treating and not just throwing darts at a dartboard.
So let's now pull together the conversation we were having about the geographic location of Envita and the
Hmm.
challenges that you had when you were a student in the allopathic medical world. Unfortunately, um, I believe everyone who goes to medical school, regardless of the type of medical school, wants to be a healer. They have a healing spirit, and we've heard from many people that they wanted to be doctors from a very young age, that they wanted to help people and they wanted to heal people from a very young age. But unfortunately, when you go through the traditional medical school system and you find yourself working at a traditional practice in a state with very strict rules that require you to work within generally accepted medical practices, it becomes very frustrating for the practitioner, because the practitioner is limited by the insurance system, what they'll be paid for, what they won't be paid for. They're limited by whatever company they're working for, because the company is not going to allow you to treat outliers clinically, even though that's what you're trained to do. And you're also limited by the medical boards, who are going to punish you, or at least take action against your license. And I guess, although I'm an attorney, I shouldn't gloss over medical malpractice lawsuits that are brought against doctors who are treating outliers but not using generally accepted medical practices, because they won't work for outliers. So when you put together that whole scheme of um, the different limitations put on doctors who have a healing spirit, they're often frustrated because they can't treat patients the way they want to treat patients and keep their licenses and keep their jobs and keep themselves out of court. So that then puts you in a position where, despite knowing what you may need to do to help someone, you're not allowed to do that, which then creates conflict between you and your patient, because you cannot give them what they need. They know you can't give them what they need, and they fail gaslit. So give me your thoughts about that construct that I just outlined for you.
Yeah, I think you're absolutely right. I think, it's a really good point that, and this has been my experience as well, that the majority of physicians out there in the conventional system, they do have a great heart. They got in it for the right reasons, just like the rest of us did. But I think the failure is not the docs. I think the failure is the system and how it's set up. So I think you're absolutely right. I know in my experience in working with conventional docs, they've certainly expressed frustration to me by the limitations that they have. And, it is a very limited system, and especially for, Lyme disease, where it's not given the attention that it deserves. And there's, problems with the testing and all the things that, I'm sure we can talk about, and you guys are well aware of. I know it's really frustrating for a lot of those docs, because they are really limited in, the tools that they can utilize, and how they can really help patients.
Yeah, and also the emotional relationship is an unhealthy relationship. You have somebody who is physically sick. You have somebody
Hmm.
who is emotionally in fight or flight, going to someone who they need to not just receive care, but to receive comfort and emotional support from. But the doctors themselves are unhealthy, because
Hmm.
they are not doing the things that they were created to do. They're not able to participate in healing the way they want to heal. So you have an unhealthy patient with an unhealthy doctor, and now you have this clash that results in so many patients feeling gaslit and ultimately leaving the medical system.
Hmm. Yeah, absolutely.
So now let's talk about Lyme disease.
Okay.
One of the things that we've observed over the last 5 years of this podcast is there seem to be as many definitions of Lyme disease as there are practitioners treating Lyme disease. So, Dr. Warren, what is your definition of Lyme disease?
Yeah, it's a really good question, because you're right in the sense that there is a lot of discrepancy in terms of that term and how it's utilized. The term Lyme disease, from my perspective, it refers specifically to a disease caused by family infections, Borrelia, and several species within that family, most commonly, as you mentioned, Borrelia burgdorferi. So most people use Lyme disease as this overarching blanket term, when really it's a specific disease caused by this family of infections. When we talk about Lyme disease, we're careful to use that distinction between the term that we like to use, which is Lyme disease complex. And that really refers to all of the things that come along with Lyme, because a lot of times people they say Lyme disease, but they're talking about mold, and they're talking about viral infections, and they're talking about parasites, and they're talking about all of these other things that have jumped on board because of that immune dysfunction. When really it's not Lyme disease, it's a collection of root causative factors that are causing those issues. So when we'll refer to it as Lyme disease complex, and that encompasses the mycotoxins, the heavy metals, the chemicals, the other infections that usually accompany that disease process.
Okay. So I think we're not too far away from one another, but let me give you our definition. I'd like you to
Yeah,
read.
please.
So we define Lyme disease as a polymicrobial, multisystemic, chronic infectious or post-infectious disease.
Yeah. Yeah, I think like you said, it's pretty similar to what we were talking about. I think it encompasses all of those different variables that you typically see, especially when it's been a chronic illness. And again, those are most of the patients that we see that have had it for years and decades and sometimes their entire life.
All right, so now let's talk about prevention. As much as I'd like to talk to you about treatment, Matt would be very mad at me if I took control of this entire podcast. So let's talk
Nope.
about this prevention piece together, so then Matt can finally join us to talk about the treatment piece. So talk to us about how you think folks can protect themselves and their families from contracting Lyme disease.
Yeah, I mean, obviously, it's really difficult depending on where you live. If you live in a very endemic area where these, ticks are ubiquitous, then it becomes really challenging, and you have to be even more vigilant. But obviously, Lyme is, or ticks that carry Lyme disease. Oftentimes are more in forested areas. So it's very common for me to have patients who, say, oh, I grew up next to a forest, or I hike all the time, I camp all the time, I spend all this time in the forest, I hunt. So that's really, really common. So if that's, the kind of person you are, then I would say you have to be extra vigilant about, covering as much skin as possible when you're in those areas. You can certainly utilize some things to protect yourself in terms of, obviously there's more chemical-based things you can use, like DEET and those kind of things. But then there's also more natural things you can do, like essential oils and various things that you can put on your skin and your body that will have some effect in terms of repelling the ticks. But I think mostly the best thing you can do for yourself is have as much skin covered, and more than anything, make sure that you're doing really, really good tick checks. Have a loved one, have somebody look at your body when you're coming out of those areas where that there's a higher tick population, because as you guys know, they can attach to any part of your body. So you really want to have a thorough check anytime you're in those areas. And I know it's challenging and it's annoying and it's frustrating, but that's where I've seen people to have kind of the best prevention, is just to make sure that you're catching that, because this is a disease that is much more treatable in the early stages. If you're able to catch it right upon exposure or within that first couple months of exposure, it's much easier to treat. So even if you have been exposed, you still want to be vigilant about finding those exposures early, because it is much more treatable.
Yeah, I mean, in fact, it's preventable if you find it early on or you avoid it, right?
Yep.
Because
Yep.
it is a disease of exposure. So if you don't get exposed, you're not going to get the disease. And if you catch the exposure vector early on, there are steps that you can take to support your immune system so that you never become chronically ill. And as we had argued to you a moment ago, we do not believe an acute presentation is Lyme disease. You may have borreliosis, for example, or anaplasmosis, or ehrlichiosis, or some other acute presentation as a result of a tick bite. but you don't have Lyme disease in our view until you become chronically ill. And there's a whole process that you have to get through before you become chronically ill. So Matt and I have actually written a book that we've not yet published.
Oh, wow.
And the title of the book is Because One Bite Can Change Everything. And in that book,
Hmm.
we actually teach a framework, a four-step framework that I'd like to run by you and get your reaction to. So we argue
Sure.
that the best way of preventing yourself from getting sick from Lyme disease is by using what we call the ACRE formula, ACRE. The A is avoid, C is check, R is remove or proper removal of the tick, and then E is the early intervention, which is a series of steps that we recommend and is largely outlined in the Tick Bite Blueprint that we have up on our website. So, give me a reaction to the framework that we've created, and would you add anything else to our ACRE framework?
Oh, I love that. No, I think that's fantastic. So, yeah, I mean, I think you highlighted all of the most important things when it comes to prevention and early action when it comes to exposure. So, yeah, I wouldn't change anything.
All right, so I'm going to let Matt now take over the treatment piece, even though I'm really enjoying our conversation. And by the way, what I didn't tell you is you really look like a doctor, so it doesn't surprise me that that was the path that you took.
Yeah, I appreciate that.
All right. So now we're going to jump into the treatment part. So Dr. Warren, I really am curious what you guys do at Envita, because you guys have an amazing reputation. In fact, so many people want to treat with you. And to be candid, I know, look, sometimes you have to pay to get quality. But the biggest
Hmm.
problem that many people face is I don't have the funds, but I would love to go treat at Envita. So I'm going to take this from a twofold approach. One of them is just to discuss what you're doing. And obviously, a lot of that has to be done under the care of a doctor. But I also want to
Hmm.
ask you some things that are maybe low cost or no cost tips that you can provide to our listeners who are suffering greatly with chronic Lyme and can benefit from some simple tips as well. So I'm going to kind of take that straddled approach here, but let's just jump right in. We had Cobra Page on who told us you guys did some really creative things, I believe, with insulin and antibiotics. So can you just
Yeah.
build that out first? And we're going to get into a lot of other fun stuff you're doing as well.
Yeah, absolutely. I mean, you bring up probably one of our most important treatments, and the reason why I say that is because, as you guys know, like as we've been talking about, you have to have this kind of multi-pronged approach in order to get somebody truly well. And so there has to be different tools to attack each different variable that you're dealing with. But the Lyme part, the Borrelia infection, is typically the most challenging to treat. And there's various reasons for that. Some of that is, the defense mechanisms, it's life cycle, it's biofilms, it's various things like that. But the main thing is because it's a central nervous system infection. It hides in the CNS. And so that's why so often you see neurological symptoms with Lyme disease. And so the reason why that's such a challenge to treat and why, a lot of times we see patients who have gone through other programs and haven't unfortunately had success is because the body is designed to keep things out of the central nervous system. You have the blood-brain barrier, which is specifically designed to keep bad things from going into the CNS, and that's a good thing. That's important. Obviously, we can't have toxicities and other things freely flowing into the brain. However, when it comes to utilizing different tools, whether you're talking about natural tools or you're talking about antibiotics, the molecules are often just too large to pass through the blood-brain barrier, so they're not able to get into the CNS. And so, especially for these chronic neuroborreliosis cases where, it's a chronic disease, you have to have different tools in order to safely and effectively get into the CNS. So that's where that therapy that you mentioned, the insulin potentiated antibiotics that we utilize, which essentially is that we are giving insulin to the patient to create a state of hypoglycemia, meaning that we're hiding the blood sugar from the blood into the cells, and the brain, which depends on that blood sugar to feed itself, it depends on glucose. It recognizes that its food source is low because we've now hidden it within the cells, and it starts to open up that blood-brain barrier to allow the glucose that is available to get in. So essentially, we're tricking the brain into opening up that blood-brain barrier by manipulating its food source, and that gives us more access into the CNS, where then we can utilize the tools like certain antibiotics and various other treatments in order to really knock down that reservoir of Borrelia that's in the CNS. So certainly you have, like I said, it's not just about that. There's a lot of different tools that we utilize, but that's certainly one of the most important when it comes to the Lyme. And I think that's a big reason, quite honestly, why we have great success.
So let's talk about that a little bit more, because I
Yeah.
think crossing the blood-brain barrier is critical, especially for people with neurological Lyme. And I was there,
Mhm.
and I did 4 weeks of IV antibiotics, and it didn't really get where I needed to be, right? It helped a little bit, but I definitely was still impaired and had a tremendous amount of neurological symptoms. So in hindsight, I have a couple of follow-up questions about that, right? So obviously your tool using this insulin approach is one, but what about approaches like other antibiotics that are thought to cross the blood-brain barrier better? I'd went to a Stony Brook infectious disease doctor early on in my experience after I was still unwell, and he had suggested that minocycline is an antibiotic that better crosses the blood-brain barrier, and many patients were having success with. Now, this is going back years ago, but what are your thoughts
Mhm.
on alternatives? So specifically the minocycline, and then also other particular herbs that people may want to use, right? And some of them like cryptolepis and things like that, that are well known by the Johns Hopkins study to cross the blood-brain barrier as well and treat. So, are there other tools, or do you really think the insulin approach with antibiotics is the best approach?
So there certainly are other tools. As you said, there are certain things that have better penetration into that blood-brain barrier. Certain antibiotics, you mentioned the minocycline, there are natural treatments that can as well. You can think of this as a potentiator, right? And sometimes quite honestly, that's enough, and we probably don't see those patients because they're doing those things, and they can have success, because they are able to get into where most of the reservoir is housed. Most of the time, the patients that we see, those things, either they've failed those things or it's just not enough. They need that additional piece. So, in answer to your question, I do think that there are other tools that sometimes patients can have success with, but this is, the next step essentially for patients who that's not enough for.
That makes complete sense. So, building on that, though, I always worry about complications, side effects, and downstream impacts, because this is a whack-a-mole scenario when dealing with chronic Lyme. You mentioned it's
Mhm.
generally more than just Borrelia burgdorferi, right? You have toxins, you have mycotoxins, you have heavy metals, you have maybe co-infections, maybe reactivated Epstein-Barr virus, right? All these things are going on. So you always have to think, what is this going to do downstream? And antibiotics generally can, have negative impact. So I guess the first question is, what antibiotic or antibiotics do you use with this insulin approach? And how do you counter the gut microbiome damage being done by those antibiotics?
Yeah, so we use various ones. Like I said, every case is different, and so there's a variety of different antibiotics that we use depending on the individual case. My experience has been, and part of the reason, one of the reasons why we utilize IV for the most part, we don't utilize a lot of oral antibiotics, is because typically IV antibiotics have less of an impact on that gut flora, and so there certainly can be some damage that IV antibiotics can cause, which of course you can do things to counteract, but it's typically far less than when you do things orally. The way that I usually will kind of explain it to patients is that if you have localized infections in certain areas of the body, so for instance, infection likes to live in the sinuses, the dental cavity, the gut, sometimes the respiratory tract. And so if you want to get things directly to where those are going, then obviously the solution is, getting things straight to where that infectious burden is. So if there's a gut infection that you want to treat, oral is your best option in most cases. However, when you're dealing with more systemic infections where it's all over the body, and it's throughout the CNS and various areas, then you don't want to necessarily depend on the GI tract to have to process out those anti-infectious agents and then disseminate that to the rest of the body. If you do it straight into the circulatory system, it's going to have a better passage and channel to get to where you want to go. In addition to that, the doses and there's different strategies when it comes to doing IV that I just have seen to be more effective. Not to say patients can't have success with an oral protocol, because I've certainly seen that. But for our patient base, the IV antibiotics are typically more effective.
Right. So we talked about IRAD, the insulin receptor antibiotic delivery, which I believe is really unique to you. I don't think we've
Mhm.
ever heard of anybody but Envita using that approach. Is that to your knowledge as well?
Yeah, the way that we utilize that tool is unique to us.
So we talked about that. Before we get into some other, immune therapies that you guys do, are there any other antimicrobials that you guys offer at Envita beyond that approach, right? Anything from a different antibiotic approach, a different herbal approach, or just anything in general from an antimicrobial standpoint that you guys use?
Yeah, so most of the time what I find is that we don't need a lot of the oral antimicrobials, to be honest with you. There are some cases where, patients, there's still a burden of infection and we need to have kind of a long-term coverage. And so we'll send patients home on some of those natural or oral antimicrobials. Most of the time, my experience is that the IVs are enough. But you mentioned some of the big players, Byron White, and we utilize those when we are utilizing the oral protocols and those kind of things, which has a lot of things that you mentioned. But in terms of the infections, there's certain antibiotics that I've found to be most successful for certain co-infections. Obviously, with Babesia, it's a parasite, so you have to have antiparasitic tools as well. But really what you want to make sure that you're focusing on is that you want to have coverage on both the life cycles of Borrelia. So you have the spirochetal form, you have the cyst form, you want to make sure that you have antibiotics that cover both. So it's not this whack-a-mole where it's just, going back and forth between those life cycles. And so most of the time when we're doing, antibiotic treatment, we're doubling up and we're doing things that hit both life cycles.
So when you do the IRAD, do you do that for a long amount of time or a long enough amount of time where it hits both life cycles between the spirochete and the cyst? Like, what is that timing there to broach both sides of the life cycle of the Lyme bacteria?
So we essentially do it simultaneously. So that way there's no opportunity for them to switch. Obviously when you have the active form, the spirochetal form, and it's threatened by the immune system and antibiotics, then it will shift over time into the cyst form. So we just essentially don't give it that luxury of switching because we're hitting both simultaneously until that burden of infection is knocked down to a point where it's not able to replicate in the same way.
When you say you're hitting it both simultaneously, is it different antibiotics that target the different phases, or is it just the one antibiotic? I'm still a little fuzzy on that.
Yeah, absolutely. Sorry, that was unclear. Yeah, so we're doing multiple antibiotics that are targeting each of the life cycles.
Got it.
Yep.
So like the combination therapy of antibiotics plus the insulin resistance, and now you're hitting it at the cyst phase or the inactive phase plus the active phase. So it has nowhere to run, nowhere to hide. You're hitting it no matter what form it goes to while doing the insulin resistance to really get into and eradicate that bacteria is what you're saying.
Yes, exactly. Yep.
Got it. So you also mentioned, Dr. Warren, that there are some antibiotics that you use that are better for the co-infection. So does that mean obviously you mentioned Babesia being a bloodborne parasitic infection. What about like Anaplasma, Ehrlichia, Borrelia being Lyme? Are there antibiotics specifically to those types of infections? And if so, what are the antibiotics that generally correlate with the co-infection?
Yeah, so I mean, obviously, the tetracyclines like doxycycline, there's coverage on a lot of different infections that you commonly see with Lyme disease complex. So doxycycline is going to hit Borrelia, especially in the spirochetal form. Oftentimes, you're going to have activity on Ehrlichia and Anaplasma. Mycoplasma is really common. Chlamydia pneumoniae, sometimes doxycycline can be effective for. So we do find that bridges a lot of gaps, and oftentimes, depending on the infections, can hit multiple targets. But certain cephalosporins can be really, really effective for the spirochetal form specifically. And then when it comes to things like Bartonella, I find that, rifampin and other medications like that can be really, really effective for Bartonella. So, I mean, certainly doxycycline can as well, but rifampin is really effective for it.
We've had other doctors tell us that, generally speaking, the standard 200 milligrams of doxy a day for even acute Lyme, and some doctors argue later stage Lyme, is effective. But then other doctors tell us that it's so bio-individual that the general population would probably benefit from that dosing, but some of us metabolize antibiotics differently, meaning the effectiveness needs to be variable. So some people need a higher dose in order for it to penetrate and kill off the microbes. And there are outliers on both sides of the bell curve that may not benefit from the standard treatment of doxycycline for a Lyme infection. So I guess, do you agree with that? And if so, is that same idea true for IV antibiotics as well?
Yeah, it's a really good point because I think you're right. We all obviously metabolize medications differently. And of course, when it comes to Lyme patients, a lot of those pathways are dysfunctional. And so, what I find is that some people are hyper metabolizers meaning they metabolize medications really fast, and so they oftentimes need higher doses. Sometimes they're hypometabolizers, meaning it's really slow and they're really sensitive and they need much lower doses. So sometimes we'll do pharmacogenetic testing where we'll actually look at the genetics of that person to see how they metabolize different medications. And then that gives us an idea of, are they on one end of the spectrum? And if so, that then changes the thought process of, what that dosing strategy looks like.
Is that a common thing? The genetic testing we've heard of for people that are looking to get various, mental health-based prescriptions, but is that becoming more common in, non-mental health worlds, especially in the medical community, where people are looking at genetics to determine what medicines would work best and also at what dosing? And if so, are you starting to see that push beyond your specialized clinic into more of a mainstream primary care or even infectious disease based model?
Yeah, I mean, I think that it's certainly the utility is becoming more known. I wouldn't say that we're anywhere close to mainstream in terms of the utilization, but in the time that I've been at Envita, I've certainly seen other practitioners utilize similar testing to be able to guide treatment, which I think is great. The more data we have, the more information we have, the better chance we have at getting people well, and that's always a good thing. So.
Do you know, Dr. Warren, is that type of testing covered by most standard insurance companies? So if somebody's listening and they want to ask their doctor to run these type of genetic tests for them, whether it be absorption rates and metabolism for antibiotics or anything, is that something that's covered, or is that generally a non-insurance covered testing that has to be done?
Yeah, I wish it was. Unfortunately, typically it's not, and it's part of the reason why most of what we offer is out of pocket. It's not because we don't want to take insurance. It's because what we do and those tests are outside of the standard model, and so oftentimes insurance won't cover it. So anything that's kind of outside of standard of care is usually not covered, unfortunately.
Yes, I want to sort of go back to what we said earlier, because I wonder if, the spectrum of people who don't benefit from certain therapeutics that we think should work, right? Or
Mhm.
maybe it's not the right tool, but I also think there's an option where it could be the right tool. So we're treating somebody with doxycycline or maybe combination antibiotic therapy, and they're saying it's simply not working, or it's recurring, and I'm feeling better, but then it's bouncing back. Do you think that could be because some people are metabolizing too fast and therefore they need more, right? Or on the other side of the spectrum, you said that they're not metabolizing. I think it's almost like they like the Herc side of it, right? They're getting sick because it's more than they need. I guess is how I can put it in my brain, right? So I'm getting more than I need, and therefore I'm getting sick, and it's not having the positive impact of an antimicrobial, or I'm not getting enough, and it's not actually getting to the root and killing the bacteria. Do you think that happens, and that's often missed because of different metabolisms to the antibiotics that they're being given?
I do. I think that's certainly a factor. I mean, it speaks to the individualization of this disease process and why it's so challenging not only to diagnose, but to treat as well, because every person's different. Everybody's, processes in their body are different. Everyone heals differently. And so part of, the art of medicine is really creating a plan based on as much data as you can, as much experience as you have, and then seeing how a person responds and adjusting to how they respond. We're usually, having done this for a long time, we're usually pretty good at, having the right aggressiveness and the right speed. But sometimes we're surprised, and we have to shift and change. So I definitely think that that's part of it. I mean, I think it's multifactorial, to be honest with you, because I think other things that contribute as well are, antibiotic resistance, lack of detoxification pathways. A lot of times Lyme patients, they can't eliminate properly. And so sometimes you have accumulation of these things and the body's not able to get rid of them as a result. So I think it is multiple factors, but for sure, I do think that the metabolism part is a big part of it.
So how do you address the inability to detox, right? People talk about they have the MTHFR gene, the double MTHFR gene. I'm never going to get better, which I frankly don't subscribe to, even with that gene, right? Or the double gene. So when you have people that are really sick and can't move and have a hard time even just getting their lymphatic system going and their livers, just sluggish, how do you help them when they're so sick and bedbound to start detoxing and getting rid of the die-off and the toxin so they can handle treatment? That's a delicate balance. And I'm just curious what tools you guys use at Envita to deal with that.
Yeah, it's a really, really good point. I always am telling patients that in order to get well from this disease, it's a two-part process. It's not just about having the right tools of killing, which of course you have to have, but it's about allowing those toxins to get out of the body because that's what's causing the symptoms. That's what's causing, a person to feel poorly. And so even if you have all the right tools and you are able to be successful at killing the infection, but there's nowhere for those toxins to go, you're not going to feel better. In fact, you'll probably feel worse long term. And so the detox is just as vital, in my opinion, as the kill. You have to have good tools on both. So we use a wide variety of detox methods, but it's a huge part of our protocols. So some of it we do IV in clinic. Some of it are things that patients do at home. We call it homework. So it's things like castor oil packs and dry brushing and clay baths and various things like that. You can do enemas, you can do colonics, you can do lymphatic massage. All of those things can be helpful. We do have some pretty fantastic tools as well that help kind of solve that problem that you were talking about in terms of the body's inability to detox, because sometimes even if you have all the right tools to stimulate the main channels of elimination, if those are dysfunctional, doesn't matter how good the tools are, it's not going to work. So one of the things that we do is a treatment called therapeutic apheresis, which essentially is a blood filtering treatment that filters the blood of all of those toxins and toxicities that we're trying to get rid of, and essentially bypasses the organs of elimination. So especially in cases where patients have a really hard time detoxing, that can be a really phenomenal tool to help kind of spare the body in terms of having to do all the work itself. Now, of course, you still need the body to work for you in order to eliminate, but there are things you can do in addition to that can be great tools. So it is really, really important part of the healing process.
Dr. Warren, what are your thoughts on mold? Because we've had some people that just specialize in mold and say, I don't care what you're doing. If you live in a moldy home and you have chronic mold exposure, and you are chronically ill, you will not get better until you either remediate the mold or move out of the chronic mold exposure. Do you agree that mold can be that devastating that no treatment will work if you're being exposed to mold?
Well, it really depends on the case. I mean, I think that's like everything that we're talking about. There are instances where that is true, but I wouldn't say that's the majority of cases. I've definitely had cases before where the main thing is not Lyme, it's mold. Their mycotoxin burden is just so significant that that's their main thing in the case. And they did have Lyme, and we needed to treat that as well. But really, unlocking that healing came from the mycotoxin elimination. So yeah, I mean, it really depends honestly on what your burden is, whether it's a mild, moderate, or severe burden. For patients who have a severe burden in their body where it's causing a lot of dysfunction, and mycotoxin burden causes a lot of similar symptoms to Lyme disease. And so sometimes it's confusing in terms of what's causing what, because there's a lot of similarities. But yeah, if you're in an environment that is toxic, it doesn't matter how much you're detoxing. It doesn't matter what tools you have. It's really rare that you can be fast enough at eliminating that's going to be faster than what's being put into the body. So you really need to be in an environment that is not a toxic environment, because in order to really fully reduce those burdens of toxic substances, you can't be putting it in simultaneously, because then again we're at this whack-a-mole game, right? Where it's like we're trying to get rid of it, but we're putting more back in at the same time, and that oftentimes doesn't work. So I think in general, for most patients, I would say if you're in a toxic environment, then the best thing you can do is remove yourself from that environment. But then again, you have to then have the tools in order to eliminate those substances from the body.
Yeah, and I think so many of us in the chronic Lyme community are stuck in fight or flight, and we're going to get into the nervous system component of this in a little bit. But I think it's very dangerous to say everybody must address mold and test for mold, and then otherwise you're not going to get better, because a lot of people get paralyzed by that. Oh my goodness, there's mold in my shower, there's mold here, right? And I'm not saying it's not harming them and it shouldn't be addressed, but I think it's also very triggering. We hear it with parasites. Everybody has parasites, and you must treat parasites or you're never going to get better. But I also think that, that may be the case for some, to your point, but not all. And point in case, we have people that, have a spouse that is living in a home with them. They both have Lyme. The spouse gets over it, but we don't hear about those stories because they get better. We only hear about the stories where they don't get better and they're in chronic mold exposure. They have to be removed from that environment because of individualized based genetics or whatever might be going on. So do you agree that it's either genetics or other infections and toxins that are causing that inability to heal? And in some cases it can when it comes to mold exposure?
Yeah, I mean, it's as we've kind of been talking about, honestly, it's part of the reason why we look at this as this holistic approach where you're kind of taking a step back and saying, okay, what are we looking at here? Well, let's not just look at one thing. What I found is that if you have a really myopic view and you're only looking at one piece of the puzzle, oftentimes it's really hard to get well. Meaning that, patients who, get put on this journey of, oh, well, I have this mold exposure, so I'm going to just treat that and see what happens. And then hopefully I'll feel better enough to then treat the Lyme, and then I'll feel better enough to treat the heavy metals and so on and so forth. So I do feel like when it comes to all of these different variables at play, that you have to take this multi-systemic, this overall comprehensive approach and address them all at the same time. That's been my experience. That's been the experience of Envita, where again, I know I keep bringing up this phrase, but it's this whack-a-mole, right? We have this phrase, this medical term when it comes to the infectious side of things, not necessarily the toxicity sides, but it's synergistic replication, which essentially means that if you have multiple types of infections and you're only treating one at a time, let's say you have a bacterial load and you're focusing on that, well, the bacterial load will go down, but you're creating an environment that's allowing for the viruses and the parasites and the fungi or whatever else you have to then grow. And so again, it literally is a whack-a-mole where it's like, okay, I knock down the bacteria and the virus spikes up, and then I knock down the virus and the fungal spikes up. So I find that to be true with all of the variables as well, mycotoxins and toxicities. So that's why when it comes to having that multi-systemic approach that I've been talking about, you really need to address all of the issues, which is why it's so important to understand what the variables are from the get-go. Because if you miss a major piece of the puzzle, it's really, really hard to get someone well. So that's been our approach. That's where I've seen to be success. Again, everyone has a different journey, and I'm sure there are patients who take a different approach and get well, but that's just been my experience. I think you're muted.
I am sorry. Yes. So, I think you hit it on the head, right? Where it's, you said it earlier, you got to do different antibiotics for the different stages or phases of the bacteria, active versus inactive. But you also got to address everything else that's going on at the same time, the viruses too, the mold as well. Otherwise, you're never going to get better and stay better. But, many of us in the chronic Lyme community have viruses, especially, Epstein-Barr is a common one. It's reactivated off the charts. So that's something you see often with your chronic Lyme patients as well. And if so, are you hitting them with a strong antiviral in addition to potentially the IRAD, insulin receptor antibiotic delivery, at the same time, concurrently, to knock down the viruses and the bacteria? What's your approach to really get it from all prongs of this illness?
Yeah, you're absolutely right that those infections, your Epstein-Barr, your cytomegalovirus, your Coxsackie, your HHV6, those are all really common viruses that you see. And the reason why is because they're common viruses that everyone gets exposed to, and most people don't have an issue with them because they have a functioning immune system. And so the real challenge with Lyme disease and Lyme disease complex is that and why it's such a difficult disease, aside from some of the things that we've been talking about, is because it degrades the immune system, and that's our main defense. So all of the things that we all get exposed to living on planet Earth that most people don't have an issue with, you become susceptible to, and so you can have a chronic Epstein-Barr infection and have that kind of chronic fatigue picture as a result. And so, in answer to your question, yes, you definitely need antiviral strategies. Personally, honestly, I don't use a lot of the pharmaceutical antivirals because I think there are other issues that come along with those. And they are very specific for certain infections. So your valcyclovir, your acyclovir are good for herpes and family infections, but not so great for things like Epstein-Barr and cytomegalovirus and other really common viruses. And those are kind of the gold standard for antivirals in the conventional world. So most of what we're using, quite honestly, is our natural antivirals, but for sure, we want to address those simultaneously because of that synergistic replication I told you about. So we find, which types of infections that patients have, and sometimes it's all four. Sometimes it's fungi and parasites and viruses and bacteria. But most of the time, you have one or two that are more prominent, and that's where you really want to focus your efforts.
So what are some of the downsides or the problems you see with pharmaceuticals when it comes to antivirals? So is it just that they're very targeted, or there are other downstream effects as well? And then what are the specific herbals you're using in lieu of those pharmaceuticals?
Yeah, so I think it's both. Certainly, they are pretty specific in terms of the types of infections you're trying to deal with. So if you happen to have an infection in the herpes family, like an HHV6, for instance, then it can be really effective. But for the majority of viral infections that we see, it falls outside of the range that those antivirals are usually really good at. So that's part of it. The other part is that I've seen that it can have impact on the organs in a negative way, and not in every case, but there can be kind of negative impacts on liver, kidneys, those kind of things. And obviously, when you have Lyme patients whose organ function sometimes isn't that great to begin with, you want to spare that as much as possible. So, and honestly, the other reason is that I just find that the naturals, in addition to being safer in most cases, they're enough. I certainly will say that I don't think that the naturals are enough when it comes to infections like Borrelia. I wish they were. If they were, that's all we'd be doing. But for certain things like viral infections, I do find that those tools can be really effective. So there's a variety of different botanicals you can use that are antiviral. Other things as well, like for instance, vitamin C, ozone, those kind of things. Essentially, any of your oxidative therapies. The way that the body kills viruses naturally is through oxidation. And so you're essentially mirroring that by creating oxidation using those tools to kill viruses.
So talking about organ damage from Lyme disease. So building upon the work, it was Dr. I believe, Dr. Brandon Jutras. I'm just looking here. So in 2019, this came out, and I think it was a few weeks ago, he did an update that not only is the remnant of the Lyme bacteria being found in our joints, causing chronic inflammation and joint pain, and it's not a live bacteria, it's the remnants, trace of the original bacteria. But now he's finding that these fragments are also being found in the liver of Lyme patients and causing liver dysfunction and persistent symptoms, right? So I think that's something to be mindful of, that these antivirals could have negative impacts on our organs like our liver, but yet the Lyme bacteria itself is also causing liver issues as well, right? That kind of is a double whammy there, it sounds like.
Right. Yeah. So I think that's more reason to be more protective, which is why oftentimes I'm not utilizing those tools because they can have negative effects.
So when it comes to the antivirals, I think you touched on some of them, but are there specific herbs that you like, right? So are there antiviral herbs that you like to use for the viral component of treatment that are either some of the homework, take home things that you give, or anything even in the office that you give people for antivirals?
Yeah, I mean, there's a lot of botanicals that are specifically antiviral. Things like glycyrrhiza, like licorice, melissa, like lemon balm. It can be really antiviral. OSHA is another one that's fantastic. So there are a whole category of botanicals that can be antiviral, and I know that there's some good companies out there that make combination products where they utilize a lot of those herbs in one that I've seen some success with. So yeah, there's definitely a lot of options out there when it comes to that.
To circle back to our previous mold conversation, we often hear
Mhm.
people telling us that binders are key to pull out the mycotoxins, to pull out the heavy metals. And I frankly love binders. If I'm just feeling sluggish, or if I feel like, oh boy, I probably did not eat the best, yesterday or today, I'll just take some binders. And I don't know if it's psychological, psychosomatic, or if it's really actually a physiological thing, but I just feel better when I take binders, right? So
Mhm.
I love chlorella. Rich has a bad experience with chlorella. We've tried a lot of different binders. But what are your thoughts about binders as like a general health tool, almost like a detox tool, like a general just, hey, I'm going to take a binder, just kind of clear up my system a little bit. And even if we're not sure if we have mold exposure or heavy metal exposures, trying different binders for general wellness overall. Is that a good or a bad idea?
Well, I think obviously, as we've been saying, it is case by case. It's interesting that you had a good experience with chlorella and Rich didn't. I think that kind of speaks to the individualization of each of our bodies and how we respond to things. I mean, that's a perfect example right there. But quite honestly, I use binders in almost all my patients. And I'm a big fan as well. Usually I'm using a combination between things like chlorella and cilantro and zeolite and activated charcoal and bentonite clay, green clay, all of those different agents from the natural side of things. For patients who have, really high mycotoxin burdens, there are some medications that can be helpful, like cholestyramine. Just kind of depends on the case, but yeah, I use binders in almost all cases. Now, obviously, you have to think about certain issues that a person might have. Binders are constipating, so you want to make sure that someone's eliminating properly. And if they're already constipated, then of course you have to think about that. Same thing with like opiates when you're trying to control pain. So there are ramifications of things, even like binders. Sometimes trying to find a time, the feedback I get from patients most often is like just trying to fit them in, especially if you're taking a lot of things orally, because optimally you do want to take them away from everything. And so that can sometimes be a challenge just logistically, but overall, I'm a big fan. And, most of the things that we're trying to get rid of when it comes to the toxicity side of things, your chemicals, your heavy metals, they're fat soluble. And so it's really, really helpful to pull them out by using binders as a result.
So it's interesting you say these binders are generally can cause, constipation and lack of bowel movements, which is critical to detox. And many people in the Lyme community have issues with that. So, for Rich, it was the opposite, right? He took just a couple of chlorella, I don't know, 2 or 3, and he was in the bathroom all morning. For me, it actually helps me, move things along, and it just makes and not to be too gross, but it makes my stool softer, right? So it actually, for me, I don't get constipated. It allows me to be more regular and more soft. And I feel like you can almost you can tell it's like pulling things out, the bad things out, right? So why do you think for me it's softening my stool? For Rich, it was just like bad, and for other people it can be binding, right? Why are we also different in that regard?
Yeah, I mean it's a great point, and not to beat a dead horse here, but it's that variability from person to person. And so I think a lot of it has to do with our mobility of our gut. Some people have good mobility within their gut. Some people's peristalsis is really compromised and they're really sluggish. So I think the mobility factor is important. I think the absorption factor is an important one as well, because we all absorb things differently. And then I think the gut microbiota is that you mentioned earlier likely has something to do with it as well. So I think there's multiple factors probably that contribute to why certain people get constipated and why others don't. I will say that I find that the majority of patients are more on the opposite side of the fence than the two of you, but everyone's different.
Yeah, it's interesting because I was telling Rich for quite a while that he had a ton of toxins in him, and that's why he was having that issue. But it seems like you just proved me wrong in several points. So Rich, you should be happy about this conversation. This is I no longer have a tool to tease you about, Rich. So
and anytime Matt is proven wrong, I'm a happy man. Not just about me, about anything.
So let's talk about the nervous system. We touched on that earlier, Dr. Warren. So the nerve, for me, I never really fully understood what anxiety or depression could be until I got really sick. And that was in my early 20s. So it was a weird feeling to have these sudden emotions that I never understood until I got sick. And I now believe that to be because of a dysregulated nervous system. Is that something you experience with your patients as well? And how do you overcome that? Is it just a byproduct of healing and rebuilding the immune system and killing the microbes that bounces back? Or do you generally find you got to do something else deeper to reset the nervous system to get ourselves back into a normal state so we're not in this constant fight or flight, anxious, depressed mindset?
Yeah. Unfortunately, it is pretty common to see those emotional changes that happen. And a lot of times it's exactly what you mentioned, where, I hear all the time that patients, I never used to be anxious, I never used to be depressed, I never used to be angry, and all of a sudden I'm this different person. And a lot of times it just kind of happens overnight. And sometimes it's more gradual, but a lot of times it is kind of this light switch that happens. And so it can be really difficult to deal with, mentally and emotionally, because you're not understanding why your body is all suddenly different, And so in answer to your question though, what I find in most cases when it comes to neurological damage, because that's a question I get asked often, is this neurological damage that I'm having as a result of this disease process, is this fixable, right? Am I always going to have this? Is this permanent? And in most cases, and there are some exceptions, which I'll talk about here in a second, but in most cases, that damage to the nervous system is repairable. And most systems, you see hormone dysregulation, you see neurological damage, you see sometimes it's cardiovascular damage that happens as a result. And a lot of times that is fixable. And in order to do that, it's all the things that we've been talking about. You need to address the root causative factors. You need to support the body, give it what it needs, and oftentimes the body will come back online. So I do find that there's not anything additional in most cases that I need to do to kind of see that repair of the neurological system. And typically what happens is that when you do those things, that anxiety and depression and anger, they subside in the majority of cases from what I've seen. Now, there are some exceptions to that. Usually if a person has kind of two concomitant things going on simultaneously, where they have let's say a true Parkinson's condition and Lyme simultaneously, or another neurological condition like MS or ALS or something else happening, which is possible to have multiple things going on. Then obviously just fixing the Lyme isn't going to fix that neurological dysfunction if there's been damage from something else. Another example that I see sometimes is if a person has TBIs, they've had multiple head injuries where there's been brain damage as a result of that trauma, then sometimes that's not fixable. Sometimes it is. Sometimes it's not, though, by just fixing the root causative factors. I will say that, as you guys are probably aware, Lyme oftentimes masquerades as those things, which is why you see Lyme patients get diagnosed with things like Parkinson's and ALS and MS and autoimmune conditions and a variety of different things, when seizure disorders and other things. But a lot of times it's not truly those things. We don't know what this is. It looks like this, so we're going to diagnose it as that. And it's really the Lyme and Lyme disease complex that's the issue. You fix that, and oftentimes those things go away. But there are some cases where they truly are separate things going on. And if the other thing is causing the damage, then obviously just fixing the Lyme part won't take care of that.
And I think to validate some of our listeners that this is not in their head as far as, an emotional or psychological thing. We've had various Amen Clinic doctors on, and I didn't know this, but on their website, they actually have, if you look at, I think it's images and then you pick Lyme disease, they show you brain scans of SPECT scans of normal brains and then Lyme brains. And it is scary to see the activity differences in the brain, right? So the lit up parts are the ones that are active and the dark spots are the parts of the brain that are not active. To see the brains and how they're different in Lyme patients versus, a normal patient is quite alarming. But with treatment, those brains do go back, generally speaking, to your point, right? So I think that should be a little bit of peace to know that it's not permanent, right? But yes, Lyme will alter the activity of your brain and cause a lot of these emotional problems that we see in Lyme patients, right? Now, another interesting factor you brought up, Dr. Warren, is TBIs, right? Rich, I'm sure as soon as you said the word TBI, Rich knew I was going to ask this question, because for whatever reason, I hear this often when I get into the treatment side and the physical side of our interviews, where so many of our guests, I mean, an abnormal percentage, have said, I have had a traumatic brain injury or I've had a concussion. And it's just interesting because is it that they are neurologically impaired, so their balance is off and they're neurologically off, and therefore they're hitting their head more and getting TBIs and concussions? Or is it something else, right? But have you seen that in your practice as well, that there's an abnormal amount of people with concussions and TBIs in the Lyme community?
Yeah, I think there is. And I think it's going back to what we talked about, what Rich was saying earlier with like the chicken and the egg. It's hard to say, is it the Lyme that's causing people to be more susceptible to getting these head injuries? Or is it the head injuries that are making their Lyme, exacerbated?
Yeah.
It might be both, honestly. I mean, it's hard to say. In some cases it might be one, in other cases it might be others. But I definitely do see TBIs in quite a large number of Lyme patients. So it is definitely an interesting correlation.
Yeah, and I want to give some hope there because Theora DeBronte, who was a former guest of ours and we've stayed in touch with, she had, pretty strong TBI and was struggling greatly with her healing journey, and she's doing great now. So it was a very difficult journey, but I just want to encourage everybody to not give up, because I think that's the biggest problem many of us face is we give up when we accept that we're broken or damaged. But I think people have to keep trying and having hope and finding new doctors, right? So that's something that I want to point out. And Theora's interviews out there on our website as well, if anybody wants to watch, when it comes to concussions and TBIs. Another interesting thing that kind of scares me, and I frankly would never do it, but we've had some good success stories, is fecal implants. And I don't know how much experience you have with this, but we've had some people tell us, like, it cured me. I was messed up, nothing helped. I did a fecal implant and I was just better pretty quickly. We've had other people tell us that they didn't get better, but it changed their personality. And because of the diversity of the microbes being put into their gut, essentially, they became almost like a different person, which is sort of scary, right? So what are your thoughts on fecal transplants and the risks and the unknowns?
It's actually really interesting that you bring that up because we do a monthly tumor board with all the docs, and our last one was yesterday, and we were just talking about fecal transplants in our tumor board yesterday. So it's really kind of fortuitous that you brought that up. Yeah, it's one of those things that I have seen some great success with patients, especially when Lyme manifests as mostly GI. Obviously the three systems that you see most commonly with Lyme are going to be GI, musculoskeletal, and neurological. And some patients, it's all GI. That's their main symptom picture. And sometimes when you just have this huge challenge of trying to balance that gut, you just can't get past that dysbiosis. Sometimes that fecal transplant can make a big difference. I have seen that in certain patients. And I've seen it especially in cases where there's other things going on. If there's a Crohn's, if there's an IBS, there's, other diagnoses that come along, then fecal transplants can be really helpful. The challenge, though, quite honestly, is that, they are FDA approved conventionally, but only for C. diff infections. So if you don't have an active C. diff infection, it becomes more challenging to go to just a run-of-the-mill gastroenterologist and get approved for that. And so sometimes logistically it can become challenging finding it. Obviously, you want to make sure the source is a good source. And then there's various strategies in terms of how you administer it. Whether you do it rectally, you can do capsules, you can do it orally. So there's a lot of variety in terms of how you administer it, what the source is it going to be beneficial based on the dysbiosis that they have? But it is one thing that I have definitely seen some cases where there's been improvement. But like we've been saying, there's no magic bullet, right? There's no one thing that's going to be, work for every single person. And so I've certainly seen cases where patients had a lot of hope and they tried it, and it unfortunately didn't help them. But I've seen some pretty amazing turnarounds as well. So
Yeah, it's interesting you talking about the different systems that Lyme can impact, right? Neurological, the GI system, right? The musculoskeletal system. And there's some research, I think from last year, maybe even longer, that came out from a research study citing that various strains of Lyme bacteria are known to impact different systems, generally speaking. So for example, I know there's debate. Rich and I had this kind of discussion recently, actually. How many strains are there of Lyme disease? Known strains. And IRADs, from Global Lyme to Project Lyme to Dr. Cameron to Dr. Horowitz, they have all different published content on their website with variable number of strains, right? So you're talking anywhere from, I think, 12 to like 17 or 18 or 19. So the lowest number was about a dozen, but knowing there's about a dozen strains of Lyme disease, some of these research studies had said, hey, this one strain will just cause joint pain or musculoskeletal symptoms, right? This other strain, if you get it, it's probably going to penetrate your blood-brain barrier and it's going to cause neurological symptoms. Do you agree with that? Because I think this was very early preliminary research, but has that been your experience, or do you test that deeply to identify these strains correlate to these types of symptoms in the body?
yeah, I think you can make some correlations there. I wouldn't say that it's black or white, like most things that we've been talking about. I think there definitely is some gray area. But some of the testing, like Agenix, for instance, where they do speciation testing, it is interesting to see kind of what is the symptom picture, and sometimes you can correlate to specific strains that pop up. So I definitely think there is something there. But I think that because it's not just the Lyme bacteria that you're dealing with, there is this synergism that happens with the co-infections and various other root causative factors. So I do think that depending on which collection of variables you have, that oftentimes will dictate the systems that get affected as well. But I do agree. I think there's definitely something there.
So I have to ask you, because I know the marketing person that reached out to us from Envita, one of the things she was telling us about in our introduction with you is about VSELS, right? These very small embryonic, I think I'm saying you're right, very small embryonic-like stem cells. And they sounded very interesting, but I don't know that I'd be able to even explain it. So before I even make a fool of myself, can you help explain what these things are and how they potentially can help the Lyme community?
Yeah, so it's really, really interesting. It's something that's been known for quite some time, but there really hasn't been a big understanding on what they do in the body and even more so how to activate them. Essentially, what they are, they're smaller than typical stem cells, but they're pluripotent, meaning that they can turn into any cell in the body, like some other stem cells as well. But the unique thing about these cells that's really, really interesting is that they essentially exist in our body in a dormant state. And while they're in that dormant state, they're essentially impervious to all of the things that we get exposed to on a daily basis. So until they're activated, they're essentially indestructible, which is pretty amazing because obviously other cells in the body, they don't follow that pattern. And so it's really, really, I think, important when it comes to utilizing them as a therapy because, one of the questions that gets asked is, well, I've been sick for so long and I've been exposed to so much. Are these cells even going to be viable, right? Because there's been so much damage to my body. And I think that's part of the reason why they're so exciting is that no matter what exposure you've had, that they can still have a lot of utility because as in that inactive state, they're impervious to these negative things. So there was a PhD out of Johns Hopkins who essentially was doing research on these types of cells. And he was doing experimentation on using this laser technology that he created. And what he found is that not only could he use this technology to activate the cells, but he could also migrate the cells to certain areas of the body. That he could actually mobilize them to certain areas by using this laser technology. And so it's really, really interesting and exciting because when it comes to various regenerative therapies, I mean, most people have heard of stem cells and PRP and even exosomes and those kind of things, where oftentimes they're systemic treatments. Sometimes they're localized. You can actually inject, but oftentimes if you want to have a more systemic effect because you want to have an impact on an entire system of the body, like the nervous system, for instance, having that ability to mobilize these cells straight to wherever you want in the body, and then they can become that cell type is really exciting from a regenerative standpoint. So it's something that we have been utilizing for cases where there needs to be more of that regeneration. As I said earlier, that oftentimes you do see that these body systems can come back online, that the body does oftentimes heal when given the chance to, but sometimes you need that extra piece when there's been a lot of damage. And so regenerative medicine can be really valuable, as you guys, I'm sure especially kind of post-Lyme treatment, when you've kind of cleaned everything up and you've gotten rid of all the offending agents, and then you're left with, okay, now how do we get the body back online and fix that damage? This is just a piece of the puzzle that can really expedite that process, and the results that we've seen have been really, really promising. It's actually something that I did personally because I had chronic neck issues and a lot of migraines as a result, and I saw fantastic results in just doing one therapy. So I'm a big fan of it. I've recommended it to patients, and I think that there's a lot of potential there.
So I'm kind of try to, maybe you could just, and you can tell me I'm wrong, so you don't have to, so
Okay.
if I'm recapturing this, just tell me. So these things are just basically in our bodies in a dormant state, and they're kind of offline helpers in our body. So this technology allows us to enable them to be active and no longer dormant, and then can bring them to a particular part of the body that needs additional support, it sounds like. Am I right so far?
Yeah, you're
Okay.
right. The other thing to mention, if you don't mind me jumping in,
Yeah.
is that they will get activated naturally by the body. Obviously, there's a purpose to them, but usually it's in cases where there's been some kind of tissue damage. So if you have like trauma, if there's an inflammatory site, then the body will activate the V cells to come and provide that additional healing. So there is that avenue to activate them naturally. This is just an additional piece to help harvest them. Essentially, you harvest them from the blood, and then you can inject them specifically into a joint if you want to have localized effect, or you can do it systemically and then use the laser to guide them to wherever you want them to go.
Is there a finite amount in the body? And if so, if our body activates them naturally, is there a chance that there are none left in a particular patient, right? I mean, it's just an interesting question that you made me think of.
Yeah, no, your body will continue to reproduce them. So it's not like you run out of them if you harvest too many of them. And keep in mind, we're taking a fairly small amount of blood in comparison to all the blood in your body.
Yeah.
So it would take a lot to exhaust the amount of V cells you have, but your body will replenish those stores over time.
Okay. So now you take it, you bring these cells, you activate them, and they can basically turn into whatever cell you need it to turn into. Now, in my brain, I'm trying to figure out, does that mean they're just going to be beneficial from a restorative standpoint, meaning repairing damage, right? Maybe, neurons or, neurological damage, central nervous system damage or whatever, or inflammatory joint damage, or are they also going to be able to help from a treatment standpoint to actually kill microbes too? So is it helpful from a treatment and antimicrobial standpoint, or is it really just restorative and reparative post-treatment? Which side of that?
So the answer to your question is yes. So it's more indirectly. So one of the interesting things that the doc who kind of created this technology has been utilizing it for. Mostly, he's been doing these like really rare neurological conditions where he's seeing these amazing results. But he has been utilizing it in cancer as well. And what he's finding is that it can be effective in cancer. And what he's postulating, and somewhat it's based on the testing he's doing, but also just what he understands about the cells, is that they increase natural killer cell production. So they work synergistically with the immune system to increase NKs, which obviously is one of our most important white blood cells for killing infection. So I think it's both to what you were saying, in the sense that there's a regenerative capability, but then potentially there is an anti-infectious capability, but through the lens of supporting the immune system.
Dr. Warren, this has been a fascinating interview, and we've really I guess, cross many, many different elements of the spectrum. And we'd keep you for many more hours, but it wouldn't be fair to you and your family and to your practice. So can you talk to us about how folks can get in touch with you and how they could work with Envita?
Sure, yeah. If people are interested in getting a hold of us, they can go onto our website. It's envita.com. Or they could give us a call. It's pretty easy to get a hold of one of our patient care coordinators, who are kind of the first line of communication when it comes to educating potential patients on what it is that we do and whether we're a good fit for them. So it would either be a website, or they can give us a call on our main line as well.
Well, again, thank you very much for taking time away from your practice and from your family to speak with us. And we'd ask you to keep us in mind for future updates. Any of the new technologies you folks are developing over there in Envita, or their new programs, we'd really appreciate it if you could keep us posted so we can keep our community updated on all the great work you folks are doing.
Yeah, absolutely. And thank you for having me. And, I'm just appreciative that you guys are doing this great work, because obviously, we need advocates in this community, and the more people that we can have to help people who are suffering, the better. So thank you for what you guys do as well.